My grandmother became very unwell very suddenly in an acute hospital. I instantly knew I needed to bring her to the hospice. Immediately, I wasn't a nurse on this ward anymore. I was a family member, I was a granddaughter. When you're sat in that room and you've been awake all night with your relative and somebody comes in and says, "Would you like a cup of tea or a piece of toast?" They were the things that kept us going. As a nurse, you want to make sure that a patient feels supported. You want to make sure that they have their priorities met. If I hadn't had the people working above me at that time, making sure that we were doing things the right way, that we were adhering to policies, that we weren't losing sight of where our areas of improvement were, then my grandmother wouldn't have had the experience that she had here. I use Radar in my role to make sure that I've got full oversight of events, risks, concerns on the ward. My then priority is actually, okay, are the team working today aware of that risk? So it's about communicating that back down. And because Radar produces graphs and charts, it just makes the information a bit more connected for the team.
Previously, we were very much doing things separately, so incident reporting was done via paper, policies was held on our own hospice drive. Occasionally they would go missing. So we've integrated everything.
It's almost like the invisible safety system. Now you get that information and it brings it all into one place. You know the trends that are coming out. You know if there's a lot of medication incidents. And all of that has led to, especially on the ward, extra learning that didn't exist before. For me, it's actually the automation part. If you can go in and you can raise your incident, and once you've raised your incident, the automation kicks in and does everything for you in that way. Nobody's had to count things, nobody's had to do an audit in a different way. It then almost takes care of itself. There's one list, incidents, DPIAs, cold cot log, you've got that one list there, you just pick what you need to do and the process is up and running. No guidance needed because the system does it for you.
I need to be able to understand where my risks lie as a ward. I need to be able to understand where the improvements are. We should always be striving for things to be better as much as we feel we're doing really well, and also to be able to acknowledge the things that are going well. If I didn't have all that information in one place, it would likely be in a subfolder here and a subfolder there, and actually the likelihood of me having the time to collate all that together is pretty slim in a role like mine. I know that if I want to find out about a policy, I can just quickly click on the right button on Radar. I know where it is. If I want to investigate an incident, I know I can upload all the relevant additional parts, so it might be a drug chart that I want to upload. When I want to come back to that incident, I know where to find it.
Once it's in the system, it's there and we don't have to worry about it. But if Radar wasn't there and we didn't utilise it in that way, compliance-wise and keeping evidence of things would be quite a nightmare.
I like the fact it's mobile, literally walking around, looking at action plans on my phone. Again, I think you can just do things more quickly, more efficiently, and implement change if you need to straight away.
We were able to implement something called a safety huddle for our ward to look at all the potential risks that are involved on running that shift. That only really came about because of what we were picking up on Radar as themes.
It saves me so much time. It means my job can be done properly. That's what I'm trying to say.
The team that we work with has such a drive and a passion for supporting patients in really vastly complex situations.
We have so much lovely feedback about how wonderful hospice care is here and how the patients are looked after.
The great bit is about hopefully making a difference in people's lives, but also from my perspective, supporting staff and developing staff.
St Nicholas Hospice is that garden, is that ability to sit in a room and look at the lights or hear the birds or see the squirrels coming in when they shouldn't be. That's what makes us us, and our ability to work together as a team. The most frequent comment that I think I ever have, and actually my mum said it when we came in, is the minute we walked in I felt the weight lifted off my shoulders, and the amount of families that say that.
It enables the family member to be a family member, to be the husband, the wife, the partner, the daughter, rather than the carer. We will support that family for as long as is need be.
To be able to be the nurse that you train to be is really precious, hence why I've stayed here so long. We can't make your journey go away, but we can give you some memories along the way, and we can give your family some really precious moments that you were really pleased you had the opportunity to have.